What do you think is going to go through the jugular foramen? I think some of us know about it, right? Jugular foramen. What do you think is going to go through?
That's a vein.
It's a vein.
Yeah.
Jugular what? Vein.
Because you could die if somebody stabbed you there.
Oh yeah, anything around here. Yep.
Is that where they take
The carotid pulse.
The pulse?
Yes. The pulse is on the carotid artery. Yes. Or what we can do, well, if a patient is having arrhythmias, you try to do what we call a carotid massage because there is a receptor right around the artery there. So it feels as if something is tensed up because the heart is racing. So the receptor send the signal, receive the signal, send it to the brain. So it comes back, and as a result, it tells the heart to slow down. Okay, carotid massage. All right. Okay. So next. So these are the temporal bones: the squamous fissure, squamous parts, the mystoid parts, and much more inside. It is what? It's the petrous parts. That's the inside. The petrous parts. Okay. All right. All right. The occipital. The occipital is talks about what? It is the rear and what? Base of the skull. The rear and base of the skull. The rear, back, and base of the skull. All right? Which is right here. This green. Okay? All right. Different thing that it has. Very important. What we call a foramen magnum. Foramen magnum is the biggest hole in the skull. Foramen magnum. Foramen magnum. Okay? That's the biggest hole. And that's where the spinal cord goes through the vertebral canal. Okay? That's the foramen magnum. And the spinal cord is an extension of the brain downwards. It goes through the foramen magnum. Okay? Yes.
So does the brainstem end before that, or does the
It
brainstem
ends.
sit, or it
It
sits
ends.
right there?
As soon as it's becoming a spinal cord, it already ends. Okay? The brainstem is just a little above it. Above it, yes. Okay? So that's the hole, the foramen magnum.
The hole is the foramen.
Correct. Remember foramen. Foramen. It means something like a hole, like a passage. So the name of this hole is foramen magnum. Alright? So you're gonna see that we got the condyle. What did we say about condyle? Condyle. Condyle.
That's where they connect.
It connects with another bone. Good. So which means this is the condyle right here. So it uses the condyle to sit on top of the vertebrae. It uses the condyle to sit on top of the vertebrae. We're going to see later on that I think we talked about it yesterday, right? But only we didn't mention something. All right. What are the different parts of the vertebral column? I know we talked about it yesterday. The different parts. Huh? Cervical, thoracic, lumbar, sacrum, coccyx. All right.
7, 12, 5, 4, or 1 and 4.
Go back again.
7,
12,
5,
4.
2 5.
2 5s,
5,
4. Exactly. Remember, breakfast at 7, lunch at 12, dinner at 5, another snack at 5, happy hour at what? 4 o'clock. We all agree that the happy hour time could vary, right? Okay. All right.
Yeah.
Somebody said yes. Good. All right. So the occipital, that's what is used to rest on the spinal column. Okay. So we have a whole lot of things. All right. We also have the canal that transmits the hypoglossal. And hypoglossal, it is what? Transmit what? Hypoglossal nerve. Hypoglossal canal transmits hypoglossal nerve, which is what? Cranial nerve 12. All right. Let's start filling it up. Little by little, you guys are learning about the 12 cranial nerves, right? Because you guys have to know it. I'm telling you, you have to know it. All right? Cranial nerve 12. That is hypoglossal. Hypoglossal. All right? Cranial nerve 8 is what? Vestibulocochlear. Cochlear. Okay? So we're just filling it up. So which means we filled one up. We filled that 1, 2, 3, 4, 5. It's all right. We're gonna finish up.
You know, fill all 12?
Yes, and you have to know it. You have to know the function. It's very important. Okay? All right. So we have a whole lot of things. The protuberance, which is one of the marking, which attach for ligaments. The superior and inferior notch lines for the neck muscles. All of these, they are ridges on the occipital. This is inferior notch line, superior notch line. These are where the neck muscles get attached to. Okay. All right. The other one is the sphenoid. The sphenoid is kind of very funky. It's kind of very funky. All right. I need you to pay attention closely. You're going to see that this seems like there is a board right here, which goes a wing. This is the center of the board, and this is the wing. The wing right here and the wing right here. That's the center of the board. Can you guys make it? Appreciate what I'm saying? Right. This is the center of the board, almost like we're going to have the beak right there. Okay, and these are the wing. These are the wing. Okay, this is what we call a sphenoid bone. The sphenoid bone. So the sphenoid bone actually helps to form part of the floor of the cranial fossa or the cranium. Okay, so this is right here. See that? This is the main parts. That's the sphenoid. So looking at it this way. All right. So it's got the body. It's got the greater wing, which is more around here, and it's got the lesser wing, and it's got the optical nerve. This is the optical nerve. Okay, optic foramen right here. Okay, now the optic foramen, it is where cranial nerve 2 passes. Optic foramen. So which means we have cranial nerve 1, olfactory, cranial nerve 2 is what? Optic nerve. Optic nerve. From that word, optic nerve, what do you think the optic nerve is going to be doing?
Eyesight.
Eyesight, for vision. Okay, vision, good. All right. So I think that's okay about sphenoid. All right, that's okay about the sphenoid. We have all of passages, right? Or all of this going through. That's okay about that. All right. So looking at it from the inside, you can see. So that it has its own sinus, sphenoid sinus. This is cutting vertical this way. What kind of slicing is that?
Huh?
What kind of slicing is this? Sagittal. Good. Sagittal. All right. So that's the inferior parts of the sphenoid. Okay. All right. The ethmoid is another funky bone also. The ethmoid, it is actually part of the one that is in the front here. Okay. The ethmoid, but much more deeper. Okay. The ethmoid. All right. The ethmoid has the perpendicular line. It's got all of these plates on both sides. This perpendicular line actually helps to form what's the superior 2/3 of the nasal septum. You know, when we say the nasal septum, remember that every of our nose has the demarcation inside, right? Okay, which divides it into left and what? Right. All right. So what actually helps to hold that septum together? It is this nasal septum. It's very sticking down this way. Okay, where the cartilage now overlay. Right. So we have the cribriform plates, which is right here, part of it, all of the foramen, so many things going on there, okay? So that's just the main thing that I really want you guys to understand. Then the other thing is, with the ethmoid forms the medial wall of the orbits. Remember, this is the orbit, right? Eye socket. We have the lateral wall, which is formed majorly by the zygote bone, zygomatic bone. Okay? The media, which is close to the ridge of the nose. So it contributes to the medial wall, which is, this is the medial wall, this is superior wall, this is the inferior wall of the eye sockets. Okay? All right? So it contributes to that. So it contributes to the medial wall, walls and roof of nasal cavity. Walls and roof of nasal cavity. All right? Remember, this is the nasal cavity. Because the ethmoid is right here. So, move up. So the ethmoid is right here. Okay? So we have the nasal cavity right here. All right? So it contributes to the roof, the top, and also what? The wall. Walls and roof of nasal cavity and nasal septum. So we can say the inner part of the nose is formed by the ethmoid bone. this inner parts, okay? Unfortunately, we cannot disintegrate this. So you can see how it's contributing to so many features around the eye socket right there. All right, that's fine, okay? Same thing. All right, the ethmoid has all of this concave. Remember I told you about this, the concave, the rigid, okay? When you stick your nose, when you stick your finger into the nose, all those bumps, ethmoid contribute to that. The superior part, the inferior part, and the middle part. Remember I said it helps to humidify the air that is going in. So it's not just like a straight. So it's kind of slow down the air so that a little bit of mucus can kind of mix with the air. Not actually so thick, but it humidifies. Okay? Very important. All right? You can see the ridges, the superior. This is the inside of the nose right now. This is the tip of the nose. The nasal cartilage. So this is the superior, middle, and inferior parts. Okay? All right. The facial bones. I'm thinking about something.
Taking a break?
I'm thinking maybe we should just move on and just do our lab on Monday, or we should just call it a day, go do the lab. Let's do the lab. All right. It's okay. Okay, because I said 12:20, right? All right, let's go to the lab. That's fine. Yeah. Do the lab.